In Fresno County, rising COVID-19 hospitalization numbers continue to be a concern. Interim Health Officer Dr. Reyes Vora saying that this is really a critical time. The county is working with local hospitals, and we did get an update from one of them that is actively working with the county. We now welcome Dr. W. Eugene Egerton, the Chief Medical Officer for St. Agnes Medical Center. Doctor, thank you so much for joining us. And we know Fresno County health officials and Valley hospitals, I'm sure, are very concerned about the rising number of COVID cases that we're seeing. We're wondering about hospital capacity at St. Agnes, and what can you tell us?
Well, we are monitoring that situation very closely. We expected to see more patients as we began to reopen. At St. Agnes, we had already put together a designated respiratory unit in the north wing of the hospital to house patients that were diagnosed with COVID-19 infections. That unit also contains an ICU so that we could appropriately isolate those patients. We have since expanded that capacity to another part of the North Tower. We do have the capacity as we need to expand our designated respiratory unit capacity so that we can take care of more patients. Obviously, that brings up some concerns regarding staffing, but we're able to handle the cases that we've been able to see so far.
So you still have beds available? Is that, I'm gathering that you can expand, but you still have beds available?
We do have bed capacity, particularly for our COVID patients. And bear in mind, we also have to provide for patients who have other than COVID-19 infections or surgical needs as well.
Is there anything you can share about the type of patients that are being admitted when someone comes to an emergency room, for example, if they're just running a fever or if they have a cough? At what point would a patient be admitted to the hospital for care, prolonged care?
Stephanie, the patient that gets admitted with a COVID-19 infection is a patient who's having significant respiratory symptoms, a cough that compromises their ability to exchange oxygen appropriately, some respiratory failure of some degree. If they weren't putting as much oxygen as needed to their blood, we check that oxygen saturation on those patients. If they are showing significant constitutional symptoms, then they'll need to be hospitalized.
When patients come in for COVID, what is the typical length of time that they stay in the hospital? Have you been releasing patients? Have you seen patients recover, or are many of them there for the long haul?
We have a variety with regards to the length of stay. What I can say is that if we intervene early in the disease process, the hospitalizations have been lasting on the order of 8 days. If a patient requires ventilator assistance during their hospitalization, the average length of stay is about 21 days, but sometimes that'll go longer. So I think that's probably a good range that we're seeing here.
Can you give us any insight into the different side effects that the hospital might be seeing from COVID? As we're hearing and learning about the disease, sometimes it takes different forms in different people, or it might evolve. It might start off as where someone's having certain effects from it, and then those effects evolve into something else. What are you seeing there at the hospital?
Well, I think that what we've seen is that there are the presentation has been a bit more diverse with some of the patients that we see here. When you first heard about coronavirus infections, you heard about a fever, a cough, a sore throat, a headache, and fatigue. But we also see patients who are admitted with the loss of smell. They are admitted some with heart failure. We've had some patients admitted with just the overwhelming fatigue and nothing else. But they then develop the rest of the constellation of symptoms that then requires further treatment. So the other thing is that this has a convalescence that is prolonged. So it takes a while to get over this. So when we discharge our patients, we do give them specific criteria about finishing out their quarantine period, making sure that they're symptom-free, making sure that they take care of themselves.
But I would imagine when they are released from the hospital, we would assume that they are no longer capable of exposing someone else at that point.
Well, they're going to test positive because they still have the antibodies, but by the time that they get to the end of their convalescent period, they should not be a danger to others.
And Doctor, I do have to ask you, because we're seeing this nationwide trend of more younger people being diagnosed with coronavirus or COVID-19. Are you noticing that trend there at the hospital, that you're seeing younger patients, and are any of these younger patients requiring hospitalization?
Indeed, we are. Our very first COVID-19 patient was a 35-year-old. We are not a pediatric hospital, so we have not seen the pediatric population of COVID, but we've seen this disease hit across all age groups. Obviously, it's harder in the elderly population, those 60 and older, but we've seen it in 30-year-olds, 40-year-olds, 50-year-olds, and you tend to do better if you have less previous health comorbidities, if you will, to accompany the disease when you are admitted.
Well, Dr. W. Eugene Egerton, the Chief Medical Officer for St. Agnes, we know this is such a busy time for you, but we sure do appreciate the few minutes that we've had with you for this update. Best of luck as your hospital and the staff there continues to fight COVID for our community.
Well, thank you for having me, Stephanie. Take care now.
Thank you.